Insulin-resistant muscle, liver, and pancreas all lead to type 2 diabetes. Dr. Ben Bikman.
What is it that is responsible for insulin resistance progressing to type 2 diabetes? And to understand that, I think we need to highlight what happens at the muscle, the liver, and the pancreas. Now let's go to the muscle first. The muscle matters because the muscle is the main consumer of glucose. When someone has eaten a mixed macronutrient meal and glucose levels have spiked, it's the muscle that steps in to save the day. The muscle will consume up to 80% of the postprandial glucose load. So the muscle plays a primary role in regulating blood glucose levels. The uptake of glucose into the muscle uses GLUT4, the glucose transporter 4. That is an insulin-dependent transporter. When the muscle has become insulin resistant, that process is compromised, and muscle glucose uptake can drop to half of what it normally is. Now, that's not difficult to see the problem. Muscle is the main consumer of glucose, and if its consumption is reduced, then blood glucose levels will be elevated. And indeed, that is an absolute contributor to the steady rise we see in glucose as someone is progressing towards type 2 diabetes. Now, if we look along the top, what we've done, I'll back that up, we have the person who's kind of right in the middle of insulin resistance, just about to start diabetes. Now we're pushing them into the diabetic realm. Now we're starting to see the glucose come up. The liver is, of course, absolutely central to nutrient metabolism at the level of the whole body. I want to highlight two processes involved in the liver with regards to nutrients, and that is the production of fats, lipogenesis, and the production of glycogen, or the stored glucose. Insulin in a normal insulin-sensitive liver will stimulate both of these. It's both driving the production of fat and the storage of glucose as glycogen. However, when the liver becomes insulin resistant, something interesting happens. Lipogenesis is unaffected. Insulin can still stimulate lipogenesis. However, glycogenesis is compromised. And now the liver that is supposed to be storing glucose as glycogen is now ignoring insulin's heat and is breaking down the glycogen. In other words, glycogenolysis has been activated, again, despite insulin's best efforts. And now the liver that is supposed to be storing glucose, lowering blood glucose levels, is releasing glucose, compounding this fight that the individual may be having with blood glucose levels. So the insulin-resistant liver is now directly contributing to the mounting diabetes. So we take this individual who is moving ever closer towards full-on type 2 diabetes. When the liver falls, we take a significant step into that territory. Within the pancreas, among the myriad cells, we have alpha cells and beta cells, each of them producing glucagon and insulin, respectively. These two are a yin and yang when it comes to blood glucose, whereas glucagon is always attempting to increase glucose, insulin is, of course, always attempting to reduce glucose. Now, independent of this indirect battle they're having over glucose levels, they do have a direct effect. And specifically, insulin from the beta cells will directly inhibit glucagon release from the alpha cells. So insulin is sort of abusive in that sense to its alpha cell neighbor, and it is reducing the production of glucagon. And that would help insulin achieve its goal to lower blood glucose. However, the alpha cell can become insulin resistant. And now insulin's inhibitory efforts are lost. And so insulin's attempting to inhibit blood glucose levels by inhibiting glucagon, and it no longer works. Once again, we continue to take steps deeper and deeper into full-on type 2 diabetes.
Insulin-resistant muscle, liver, and pancreas all lead to type 2 diabetes. Dr. Ben Bikman. What is responsible for insulin resistance progressing to type 2 diabetes? Muscle is the main consumer of glucose. After a meal and glucose spikes, muscle saves the day, eating 80% of postprandial load. Glucose uptake uses GLUT4, an insulin-dependent transporter. When insulin resistant, this process is compromised. uptake drops to half of normal, making blood glucose levels rise, leading to type 2 diabetes. Someone who is in the middle between insulin resistance and type 2 diabetes, the muscle insulin resistance pushes them into type 2 diabetes. The liver is central to nutrient metabolism. It has the production of fats, lipogenesis, and the production of glycogen, stored glucose. In a normal liver, which is insulin sensitive, insulin will stimulate both of these processes. When the liver is insulin resistant, lipogenesis is unaffected, but the glycogenesis is compromised. Then you have glycogenolysis, which sends glucose into the bloodstream. Dr. Bikman says, directly contributing to diabetes. In the pancreas, we have alpha and beta cells, each producing glucagon and insulin. Glucagon tries to increase blood glucose, insulin tries to decrease it. The beta cell insulin directly inhibits the alpha cell glucagon, thus helping it to lower blood glucose. But when the alpha cell becomes insulin resistant, Dr. Bikman says, the insulin's inhibitory power is lost, thus moving the patient more into type 2 diabetes. Annotated and summarized, easy to share with loved ones. To access these annotations, go to doctorstotrust.com or see the description below this video's title.